So my name is Marcel Koek. I represent today EuCanImage, where I want to tell you something about the data platform in this project that we've designed and how different parts of this platform are linked together. So I'm a research software engineer. I work in Erasmus Medical Center, and I'm part of the population imaging flagship node of the Euro-BioImaging. So at a glance, EuCanImage platform, the aim is to combine or to collect actually the different data sets that are distributed across Europe and make them available to researchers through storing them on different platforms that are suitable for storing the types of data and get them accessible through data access committees and an access manager. So for that, we need to build the aim is to build a federated, also GDPR compliant, scalable and fair cancer imaging platform. And so the result looks something like this. It is way too much to go through in detail, but let's focus on the part here, which are the places where data is stored for people to access the data. I will go through them one by one. So how to store imaging data of more than 25,000 patients. So we start with the imaging data. So in EuCanImage, the choice has been made to go for established research infrastructures providing services. In this case, the imaging data is provided by Euro-BioImaging, represented by us in this project. Well, we all know what Euro-BioImaging is. We are the population imaging flagship node. And we use XNet as a tool to store the data for medical imaging. It's an open source platform for doing data management on medical imaging. At the moment, it contains more than 160,000 scan sessions, and we're already live since 2014. So that's looking back, that's quite a long time already. It's that time flies. It's actually hosted on certified hosting platforms. We have actually a help desk that people can go to for first-line support. That's provided by HealthRI. That's our Dutch national research infrastructure for health and life sciences. And we provide it as a storage as a service, which means is that we offer this storage as a processor. So in GDPR terms, people who are into that. So if you want to store your data here, we agree on a DPA. And you, as a data holder, have always control on who can access your data. We are not. We only provide a service. So what's XNet? What can it do for you? You can store your data. You can download your data here. You can do organization and share this data with others. There's fine-grained, secure access and permission control. You can search through your data, and you can provide access to this data for processing. So to highlight some of the aspects, so it can store both DICOM and non-DICOM data, but the core functionality is built around DICOM, but it doesn't exclude other types of data. It has a web UI to browse through the data and do your management tasks, and it has an API to interact with this programmatically. There's an active community, a regular developer and user workshops and meetings are being held where people can learn and share ideas and develop the platform further. On this XNode instance, there are also a couple of public data sets stored that are freely available. People can go here if they want to have a look. Continuing for clinical data. For clinical data in EuCanImage, the EGA is used, which is provided with support in EuCanImage by the CRG in Barcelona. For the EGA or the clinical data or non-imaging data, and we refer to that in that way, some data models has been developed. This was quite a daunting task, I would say, and we did that in this project through 7 use cases, which targeted different tumor types or cancer types. And in the end, what we ended up is actually per use case, there's a slightly different data model, but all the data models are based on existing standards, or in this case, it's the main ones are FHIR, ICD, ICD-03, ICD-10, I think, and SNOMED-CT. So there always is, so this is kind of, those are the common denominators, I would say, between the fields. There's a kind of a tiering in this data model. So there's a minimal set. If you want to have your data in this platform, you at least need to provide this set of data that is specified. As an example for use case 1 here, there's a liver use case. There's a couple of mandatory fields that you need to adhere to. For the data upload to the EGA, RedCap was used. It's a data capture platform which provides tools or means of staging your data and transforming the data to the data models that we ended up with after developing these. And this gave a very good platform to make sure that the data is in the right shape. And it can be stored on the EGA. Paper has been published in this as well. You can find it under this link. So as a summary for the data platform, what did we do and what there was needed to store all these data following the FAIR principles? Well, we adopted standards for the imaging data, obviously the DICOM standard, but for the rest, FHIR, SNOMED, LOINC, and ICD. It's based on existing research infrastructure, namely EGA, Euro-BioImaging. We used XNet, RedCap, and EGA tools, and we support both federated as well as centralized analysis. I didn't go into that too much. Well, I didn't go into that at all in this talk, but it is part of it. How to actually find all this data? That's another part which is important for how we approach the linkage of all the data, and that's done through a catalog. This catalog we do in collaboration with IBER, and is based on homogeneous software. So at the moment it's hosted by IBER. We store metadata here about all the collections or data sets, if you will. And from this, we link to the different storage tools. So for imaging, XNet, and clinical data, EGA. So how does this work? So in a catalog, there is from the data owner, they can add their collection to the catalog, and the people looking for data can search through this catalog and get the information needed to ask for us or request for access and get links to the data that's stored. And I'm sorry for the image quality, but how does this work? So this is kind of a list of all the collections present. You can filter in this list. In this case, we filter on body part brain from the Netherlands containing MRI, and you end up with a list. And for instance, if we now zoom into the EGD database, you get an overview of what's included and where all the data is stored, and this kind of information. So to zoom in a bit more on one of the EuCanImage use cases, here's a lot of data that you can see and that you can make sure for yourself if you want to have access to that data. And here you see the links to where they are stored in the respective platforms for the data. So at the moment, it purely relies on manual input. That's something we're working on changing. Actually, we want to make this more automated. We do this in EuCanImage actually. That's a project that we're also involved in. And for that, we are going to use FTP, and we develop DCAT application profiles in order to make this automated linking possible. To summarize, to make your data findable, we constructed a metadata model for imaging collections. We used that in the Molgenis software. We link to the data from this platform. Currently, it's all on manual input, but the future will be to make this all automated. So that's a bit more streamlined, I would say. And that's what I wanted to tell you today. Thanks for listening.